time now for our weekly visit with Dr. K, Dr. Kevin Kavanagh. Good morning, sir.
Hey, good morning, Jack.
Dr. Kavanagh is a retired physician. Also, he's the founder of an organization called Health Watch USA. You guys just had a big conference, and I'm sure there was a lot of information that was shared there.
Well, there was. And believe me, Jack, when you talk about worker safety, I think we're just starting to scratch the surface of what's going to need to be done in order to keep our workers safe from here to the future. This includes both getting better air quality within the workplace, also providing them with protective gear, etc., because we're going to continue to see this virus, that's COVID-19, surge. And, that's something we need to prepare for. We just can't close our eyes and ignore it.
I noticed there's a lot of information out now about long COVID, and you say that this information, one particular study found that 21% of patients end up with long COVID.
That's correct. That was out of the City University of New York, and we're seeing this more and more. And it's not just respiratory. This virus affects every organ system of the body. And these symptoms are very common, especially when you talk about brain fog, mentation, etc. A lot of people are coming in with heart palpitations. I had an episode of that over the summer, and the cardiologist was saying they've seen a huge uptick with these sort of complaints of heart arrhythmias during the pandemic. I went to see my primary care doctor and talked with him, and he said, well, just about everybody I'm seeing with COVID develops some lasting symptoms. And a study out of Britain found that 70% of their population has been infected with SARS-CoV-2. That's the virus which causes COVID-19. And almost 2 million people report symptoms of long COVID, in other words, more than 4 weeks. And of those people, 41% had these symptoms for a year or longer. So this is something that is not uncommon, is hanging around. It's something which I believe, and there's been other think tanks and studies which have shown that this is impacting our workforce. And it's one of the reasons why we need to start doing things differently to keep our nation competitive and keep ourselves healthy.
I have a reporter from Fox News Radio joining me in about an hour, Tanya J. Powers from New York, and she is reporting on a story that says more than 4 million Americans have now received the Omicron version of the COVID booster shot. Is that sounds like an impressive number to me, is it?
Not nearly enough. I mean, I'll be honest with you, Jack, just having any booster, a single shot even, you're looking at 38% in the United States. We are 70th in the world for boosting. That's not good. We're 68th in the world for vaccinations. And so, Jack, we're not doing nearly what we need to do to keep our population safe. You hear these conspiracy theories and all this, I think, just malarkey regarding vaccinations and its effects, etc. You go to other countries, some countries have over 95% of the eligible individuals vaccinated, and their death rates and hospitalization rates are so much lower than what we're seeing here in the United States.
I think that's where the disconnect comes, because people will say, I have known so many people that have gotten vaccinated that still got COVID.
Well, and you're going to get that with these vaccines, and that's something that we found out. These vaccines cause antibodies in the central part of the body, in other words, what circulates in the blood, but they're not real good at generating IgA antibodies in the nose. So people do get an initial infection, can spread it, but overall it's mild. And when you talk about long COVID, 42% of unvaccinated people in one study developed long COVID. 3 doses of the vaccine, which is just one booster. Right now you could get 4 or 5 total vaccinations. When you get that many, you drop down to 16%. So you go from 42% to 16% chance of getting long COVID by being either unvaccinated versus having a 3-dose or more vaccine. And so they really need to start doing this. These vaccines do have an impact on keeping you from getting deathly sick and also keeping you from getting long COVID. So when you read these dire numbers, it's up to you. If you've got the tools to keep yourself safe, you avoid crowded indoor settings, especially during surges and if you're at high risk, and get yourself vaccinated. It's of utmost importance.
Always good to talk to you. Thank you, Dr. Kevin Kavanagh.
All right. Thank you, Jack.